We talked about the conversion factor, how that's changed, the efficiency adjustment. Those certainly made the headlines. Were there any other changes to the fee schedule that jumped out to you that maybe didn't get the attention of operators and consultants in the world?
Yeah, I think the practice expense adjustment is something that we're seeing. Historically, the physician or the work portion of the fee schedule actually had two different fees depending on the location of service. So if a provider was providing a service in a hospital under a hospital tax ID, then it was based on a facility fee schedule for the professional service. If it's done in a clinic, a non-facility, then it would actually be a separate fee schedule. Well, the practice expense is being looked at in the same way. I mean, typically that was one expense number or one expense value by service, regardless of where it was actually being performed. Now we're going to see a similar thing where there's actually going to be a different expense portion or a different expense rate of the total RVU based on that location of service, whether it's a facility location or an outpatient location. There's been a lot of, with this particular release or this particular final rule, there's been a lot of pushback around some of the lack of transparency about all these adjustments. So I know the AMA has made a couple of comments. I know MGMA, some of the other organizations have basically said, we understand the methodology, but there seems to be some lack of transparency about how you're going to get there. And I think that the PE portion, the practice expense portion, is one of those areas where we're not really sure how that's going to impact individual practices because we've never had it. We've never really had it adjusted that way. And like, all of these things are so nuanced depending on your practice patterns, your specialty, because it's all CPT code level. So one doctor who's of the same specialty, but maybe practices a little different than another provider of the same specialty could see a difference in what the impact is, whether that be through the efficiency adjustment or even through the practice expense change that we just talked about.
Yeah, when I hear this, I think about what is the impact from an organizational perspective, right? You have changes to your reimbursement and revenue. Now you also have changes to your clinical compensation models if you pay a lot of providers on the work overview model. Mm-hmm. That can impact your net income. And healthcare operations are generally pretty low margin areas. And having these changes year to year can just be very disruptive to your operating strategy.